No. Okay. And do we do translation online? Everybody seems to be on. Right? Okay. Can everybody see it? Can people online see it?
Yes,
Okay, beautiful.
yes.
So we are coming from Hudson Physical Therapy, and we located in Century Building. It was 2121. We do physical therapy and occupational therapy. Right now we have OT here, beautiful OT here. I'm one of the three PTs who's in the building. We do work with different ages. We do work with different problems, and post-surgical, geriatric recovery, pain, surgery prevention, prehab, rehab, usually all of that balance issue. We prize ourselves. We're trying to provide the best PT in the neighborhood. That's usually what we're getting a feedback from most of our clients. We exercise approach when we do customized programs for every single patient. So we're trying to make sure that the patients progressed individually versus just, okay, group starts, group works, and then you just progress with everybody. Everybody selected, getting selective exercises, everybody getting selective program. I see some clients that I met before, and I'm sure you can attest to that. Also, I think it's a very special thing about ourselves that I can say we establish a good patient-doctor protocol in a way that we're trying to make sure to follow your feedback, how you feel during the therapy, how you feel after the therapy, because we see you only for an hour, hour and a half, and then rest of the time you either going about your business or you're at home. So we understand that it's very important for us to collect that feedback to understand if your therapy is going the right way, to make sure that we adjust it correctly, progressing correctly. So that was a few things about us. We have 2 blocks today, and we're going to talk about lower back pain due to arthritis. We're going to talk about a little bit arthritis, a little bit back pain. I'm going to go more on anatomical part, what physical therapy does, and Lauren going to go about functional part. So we can do, after my part, you can ask questions, and then Lauren going to present her part, and then you can ask her questions. So just try to wait until that break in between, and that's when we're going to be happy to answer all the questions. Same as everywhere, and with every single patient that I have, I encourage a lot of questions. I believe informed patient, that's a healthy patient, because you have to understand what's happening with you, what's happening with the body, and what's needed to be done. Before I start, any questions? Okay, let's go. And those who will participate will get some prize.
Incentive.
Some incentive. So, as I said, we're going to talk about back pain, what limitations it poses on you, and strategies to go around that. Okay, so causes for the lower back pain. They are similar, but in effect us at different times in different days, different situations. So it's usually muscle, ligament strains, herniated disc, osteoarthritis, spinal stenosis, osteoporosis, sciatica, scoliosis, infections, diseases that some form of arthritis. There is an infection, tumors, many other medical conditions. The one that are listed here that's most common, and unfortunately, before you're going to start having back pain, you might have number of them, such as herniations and stenosis, osteoporosis and stenosis, or like 3 or 4 of them. The problem with that it's not that you always understand what hurts or what's the problem with the back when you see MRI. MRI might show herniation. Okay, good, but the person could have get that herniations years back and it never was symptomatic. And it frequently happens that they've been treated for the herniations, but the pain still stays. And sometimes they might have muscle strain, but the herniation is there, but then symptoms for the patient, the back pain, it hurts here. And then what I do, I just need to do that. But the therapy will be different in both cases, and the response to the therapy will be different because sometimes herniations can cause the nerve, can do weakness, can cause a number of different symptoms versus a strain, it's simply local specific pain. And for the patient, it's still pain in the back. For us, it's a different approach. So we know how to do it, we do it frequently, and we try to dissect every case that we have because, as I said, you might have a number of cases. We just need to figure it out when you come in, what causing your pain, what causing your limitations today. Either it's herniations, either it's stenosis, like some we can affect, some we can't, some we can help you deal with, or show you how to accommodate your positioning, how to accommodate your daily living situations to help it. Oops, wrong way. Definitions. So definition of arthritis, as I said, there's different cases. Some is osteoarthritis. That's mainly when you have the effect of cartilage. That's frequently, it could happen in your knees. Frequently people refer to the knees when you're gonna hear bone on bone. Same goes on the back, and also rheumatoid arthritis. The difference is everybody hears it and they use it interchangeably, but for us it's a big difference because it will show us the planning and how we can affect it. It's also recommendations what we can give it to you, either dietary recommendations, either follow-up with the physicians or the neurologist. I believe the presentation will be available, so you may briefly go through, you might go in detail later on. So for you to see the difference in how it looks on the joint, I have the next slide to present. So if you're gonna look at it, that's a normal joint. You can see joint capsule, you see cartilages around build up. That's basically glossy feeling. I didn't find a good explanation for the spine. That's why I just pulled up the knees slide. So sorry about that, but play around with me on this. So osteoarthritis, you see the cartilage here, it's healthy and nice. And with the osteoarthritis, your cartilage is gone. Does it mean if the cartilage is gone, you have to be always in pain? No, it's not always like that. Sometimes people bone on bone for a while before they feel pain. Even certain form of deformity arthritis, they might not present with the pain itself until we have destruction of 25% of the spinal body, and the person might not feel the pain. And only then, like after we reach 25%, then a person feels pain, and then like very few things can be done. Usually it's going to be a spine fused, and it's usually rendering for the surgery. Same as people who has osteoporosis, they might have, oh, I have stiffness, I have discomfort, and it's like been with me for a few months, and then you do the x-ray and you see the fracture. There's like, somebody would say like, oh, I'm walking with my back broken. But it is possible, but it's still presenting as a stiffness. Why it happens? Because body able to generate compensatory behavior, meaning stiffen up. Why over time we stiffen up? Because body compensating for something. Either it's compensating for the structure joint that is unstable, either it's compensating for some other reasons because brain thinks, oh, it threatens my well-being. I want to make sure that it's safe. I want to stiffen up. And your ligaments become stiff, your tendons become stiff, your muscles become stiff. So that's why when we're working with you, and it's like especially with somebody who's a little bit over 25, I can say like, listen, we're gonna start working with it, and we might pull up more things. And that frequently, as I see on the beginning, especially of my practice, when I didn't spend enough time explaining the details of possible feedback, people would say, oh, I started to work PT and I felt worse. First 4 or 5 times, that's your adaptation. Your body will not figure it out, is it getting better or is it getting worse? Therefore, I tell them, hey, you might feel worse, you might feel worse than ever. I make sure that we're starting slow, but when you come back, you tell me what you felt. You tell me exactly. If you cannot tell me what you felt, you tell me, hey, something strange right here. And I will follow up with the questions to help you make sense out of it. I will explain what's happening to the body. Therefore, the communication is everything. I see that's a bigger contributor to the drop-off. It's a significant contributor to the drop-off. And just to leave it and just pop the pill and do injection and do nothing, that's terrible. Sometimes injections and medications are necessary for us to be able to do more things. Then I will tell you, hey, you have too much pain, I cannot do my job, go see a pain management, go see your primary care physician. We need to do something like that. If needed information, we will speak to them, we will explain what we do, we'll explain our strategies. So, and here, just to explain, like, it's also arthritis, but it's rheumatoid arthritis. It's basically autoimmune disease. That's basically body attacks its own cells. For some reason, body decides like this cells in the body like foreign or harm itself, and they start in inflammation. So you see, you can have the cartilage intact, but everything around is swollen. Everything around is basically affecting the mechanics. Imagine the mechanics in the joints like a train going on rails. If you're gonna start putting a lot of dirt, a lot of stones on rails, it might cause the train to go away if it's big enough over time. So what we have in people starting to feel swelling and like starting to feel pain in the knee, what's gonna happen? I'm gonna sit all day. I'm gonna minimize my movement as much as I can, just not to trigger it. That they know of is eventually, because you weakening the muscles, everything around becomes weaker. Your joint is becoming stiff, simply because it's constantly inflamed. If it's not addressed on time, it's much harder to get you out of this. But the good part, so for example, RA, rheumatoid arthritis, the recovery in life with that is very possible. There's a lot of research indicating that it does respond very well to dietary changes. There's a medical treatment that can be done with that to decrease the inflammation. Then you're working with the muscles and you basically becoming a friend with a very noisy neighbor. It still bothers you sometimes, but most of the time you're okay with it. So that's basically the strategy for that. And it does require a lot of work. You cannot just say like, oh, I'm going to PT 3 times a week and that's it. No, you're gonna have the homework and we will know if you don't. So that's why we might not give it to you right away, but it does work. It does need move. Motion is lotion. That's one of the phrases that sticks, and it does. Because here's what happens about on that phrase. Over here, that's inflammation of synovial fluid. Synovial fluid in a joint that goes to all the major joints, your shoulders, spine, knees. It's a thicker fluid that actually feeds the cartilage, that also greases the cartilage. That's basically your oil. And with the RA, that's inflammation in that oil. That's oil becoming unusable. But when the inflammation is down and strength coming back, that builds up reserve in the knee that it can withstand certain levels of inflammation without pain or significant limiting pain. That's it. Okay, let's move on. It's a lot of information. Oops, one second. Lower back pain can affect mobility and balance. So how does it affect or come down to the balance? You're not moving, everything becoming weaker. Your brain losing the strength that it can pull, and I'm referring to muscles, to balance your body. You're not having enough endurance. You're walking for a block and then you're like, okay, I'm tired, I'm losing body, and it's like, cannot move it. It's simply depleting energy in the body, and the brain may scream, hey, come on, go, but your body cannot, there's a result in the fall. So that's one of the ways how it's affected. A lot of different body parts inflamed at the same time. It does affect your blood, it does increase your inflammatory level in the blood, it will eventually affect the vestibular system. So all of that has to be worked through, all of that has to be addressed. Yes, you cannot address it right away. You usually go from the most severe, and that's what I suggest to the patients, like, hey, you have everything all over the body, like, what hurts you today most? Let's start with that. And then if it could be something else, I'm like, okay, that's your elbow. Let's probably work with your back to get you moving, and then we're gonna address your elbow. For elbow, we can do this and that. So we also guide you where it's better to start. So that's another thing. Pain alters your gait. It alters your way you're sitting. It alters your way you're moving. And that actually is significant because over time you might see people walking like this. It's not because they clumsy. It's because the muscles getting weaker, they're not walking along. To walk straight without your hips moving, you have to have enough. For example, I'm lifting this leg, this muscle has to be enough to prevent the hip from dropping. How, if this is weak, how I can walk? I lean forward, I put my center of balance over the leg, and then I can compensate without using my muscles. Eventually, what's happening, it's same as driving a car with deflated tires. Car gonna be ruined over time if you using inappropriate mechanics. Same goes to knees. There's like, hey, my back was hurting for 10 years, but right now I'm coming for my knee. Why? Because you were compensating for the back pain and your knee was suffering. And that's frequent repetitions. Like sometimes I even had cases, people coming, hey, this is my ankle, it's swollen, it hurts. I see how the person walks, I'm like, how long, what's wrong with your back? But I'm here for the ankle. How long does your back hurt? About 10 years. And that's usually takes time. It's not gonna be like longer time, but like it goes down the chain. Same as like, first, oh, my shoulder compensate, but then elbow and wrist and everything. And it can start from the neck. So everything related, it's like one system. You take out something out of the system, something else it has to compensate. Bill is always going to be paid. Okay, and importance of managing of lower back pain is, I believe, to address everything I said before. That's why it is important to address. If you have pain, treat it as the ring for your system. Frequently, even like right now, it's younger and younger generation that we're starting to see, like 20 years old. In my 20s, I'm like, back pain, okay, maybe I did something stupid and I fell and then I pulled my back. Yes, but right now I see like even we have young guys helping us, like leaning forward. Look, I was like, what's happening? Like I got shot in my back. What's happening? Okay, I overdid in the gym. Why? It's like, and then it happens more and more frequently to younger people, and it's especially over time. That's much harder to go and fix. If you walk with the pain for 5 years, fully get rid of it, it's about 4 years. Like fully healed it strong, if you do everything properly. Ideal world. But in general, if you start feeling pain, that's your first bells, hey, body, take care of me, like brain, do something to address it. Don't just put it under the carpet. Eventually, it's not gonna go away until you pull it off and throw it away. Like it has to be addressed. That's your body.
Excuse me. Hello. No. This is me on the Zoom link. Can you try doing this without your microphone? There's an echo on your microphone.
How about now? Is it better?
Yeah, much better. Thank you.
So working on a position that if you have pain and you're not addressing, the longer you wait, the harder it's to get out. Yeah. That's basically my conclusion on this. How physical therapy can help. We teach you strategies, and Lauren gonna go over a few of them soon. We strengthen your body, we strengthen your joints. We go all around to make sure that your hips are strong, your knees are strong, your back and your core is strong. Even if you're coming with the knees, we always doing 1 or 2 exercises for the core. The knees are growing from the back, basically. So we go all around, and there's a bunch of reference sources that you can follow and read more detail on the full research that supports it. Sometimes people able to avoid the surgery if it's early in the stage. Sometimes they actually can prep themselves. That's where the word prehab. That's when like, hey, you need to do surgery. It doesn't mean you have to sit on the back for that month and wait until the surgery goes. If you do the surgery at the point, like at least starting a month before the surgery, the surgeon has a better tissues to work with. Your muscles becoming healthier, your blood flow improves, the muscle become more distinguished, less adhesion between the fascia and the muscle, and the surgeries is much better. We had very, very good results with the prehab. It's just starting taking steps when people becoming more conscious and aware that, hey, it's actually an option that I can do it before. And the recovery is much easier. Same goes for the knee surgeries and back surgeries. And that's the end of my part. Lauren is next. Before I move on and pass the mic to Lauren, yes.
You said that we have to work on certain things for that before surgeries and.
If, for example, in a case if you scheduled for the back surgery, let's say, and you have a month, that's a great time to start actually, at least a month to start getting ready for that physically. And then you telling us, hey, this is what I'm looking for, we're gonna get the program for you ready.
I have but I'm still having physical. And like you said, know that I'm substituting and I can feel myself off, like you said.
Yes.
And walking, but I also have, it feels like a bubble. And I try to sleep in it'll.
So those things that we can address also with post-surgery. So even though like you had a surgery, they minimal, like laminectomy, small disectomies, small scar, it's easy rehab. It's frequently needed to be addressed as well. And we do have good results, bad results, like meaning post-surgical. Somebody has a harder rehab, some very easier, but you have to continue rehab. If you did the surgery, it means you better address it because like everything got to reset. Like you're rebooting your computer, you lost logins into your accounts, you have to re-log in. So that's why you have to retrain the muscles, re-show them how to activate because your brain is not sure what I can activate properly without stressing the area or not, because it's a little bit of a neuromuscular re-education that has to go.
And how much time?
Depends on the case. So basically the best thing, just step by, we're gonna do eval and then we'll give you at least like approximate times and idea of what's going on and where you stand. Or at least we can teach you, hey, this is what you can do at home, or this is how you can sleep to feel better. Any other questions? Yes, please.
What about maintenance? How does that affect?
You tell me.
Can you, and also, if they ask a question out there, can you just repeat it so people online know what the
Okay.
question is? Thanks.
About maintenance.
What's the relationship of nutrition in relation to the pain that you experience?
So the question is, what is the relationship between nutrition and pain experience? Certain foods may cause increased inflammatory rates in your body. So it is going through, like, and right now, I actually recently listening more and more information coming out about nutrition and affect like mental health and even like inflammatory levels. So that is extremely important. And if it's done hand in hand, the results much better because your body has more minerals and nutrients inside available for the recovery than if it's your nutrition is poor.
All the very specific foods that
That's so specific to the case. So that's something that we can talk. Other questions here?
Do we have to be referred by a healthcare provider to Hudson?
No, physical therapy at this point, as you heard my Dr. Glavkart says, so we exercise direct access. Usually what happens, you can start your care without the prescription, but we would ask for the prescription within first 10 visits or 30 days, whatever comes first, based on New York State requirement. Even if your insurance does not require like specific referral. When you come in with, for example, Medicare or Medicare Advantage, you just have some information about your primary care physician, and you can visit them or call them to send us a prescription with it.
Does anybody online have any questions? I guess that's a no.
And also we.
No, thank you.
Go ahead.
Was that a yes?
No,
Okay. Let me see if I can turn this.
Also, we recently opened up another location. It's on the 2735 Henry Hudson. Suite 103, you can pick up some cards right there as well. We propagate the same level of care. I'm here twice a week, and most of the time, Dr. Artem is here, and that location is at home.
You have the same people over the top,
Yeah, you're gonna see me there if you can do it.
but that's across the highway
Yes, right on the other side.
where Manny used to be.
Yes,
They're not there anymore.
me there.
Are you asked?
Me there. So it's Riverdale Physical Therapy, and we kept the name. It used to be, if you remember, Dr. Jerryman used to practice there for over 35 years. So we took over that location.
And also the massage therapy.
We do manual, so it's like more targeted manual therapy, whatever is needed for the, because you not always can just do it with the exercises. We do recognize it, so we apply it. So it's not your regular massage people relax, but sometimes it hurts. But we do address it. Yes. More questions? All right, let's Lauren tell you all about.
Yeah, let me know if there's a feedback.
I think you're okay.
See, I love Dr. Gleb because he speaks from his head. I have my notes, so bear with me. So like Dr. Gleb was saying before, back pain can affect all types of daily activities. And when we can't do a meaningful task independently, that affects our self-worth and our self-esteem. So at Hudson Physical Therapy, we strive to help you manage your pain and maintain your independence with any specific activity that is meaningful for you. Just a brief overview at the clinic. I know Dr. Gleb mentioned this. We use a variety of modalities for immediate pain relief, such as hot packs, ultrasound heat, electrical stimulation of the back muscles. Manual was mentioned, which is like trigger point therapy, trigger point release, stretching. We also address further injury, prevention of further injury via education on mechanics. Oh, is there feedback? Nope, we're good. Okay. Proper posture for safe movements and adaptive strategies for these activity challenges you may face. And we'll talk more about that in a little bit. Therapy is also, we guide patients through safe exercises to improve spine flexibility, strengthen the abdominal muscles, the hip, back, glute muscles. We also encourage and support patients on their journey for a more healthy lifestyle. As Dr. Gleb mentioned, it could be talking about eliminating certain food items that will produce back inflammation. Some things that they say, studies show that increases back inflammation are caffeine, alcohol, gluten, sugar, basic nightshade vegetable, basically anything that's delicious. And we also can help people on their weight loss journey to reduce the back pain and encourage aerobic exercise because that's important for good circulation and promoting of healing. The lifestyle support is more, we're here to help guide you. We specialize more in the immediate relief and the preventative strategies, but we are supportive in lifestyle support. So I mentioned that we teach body mechanics at the clinic because we are very, very focused on proper form. If you go to the gym and you do a whole bunch of sit-ups to try and get chiseled abs, but you aren't maintaining good posture during that exercise or moving throughout your day, you'll still have back problems. And learning the right way to move and position the body for different activities will prevent injuries. So as you can see in the image, a healthy spine in the neutral position is S-shaped, and it has three natural curves: a forward curve at the neck, a backwards curve at the upper back, and a forward curve at the lower back. And good posture that you do helps maintain these natural curves. Poor posture will do the opposite, causing back strain. So if you were to look in a mirror at yourself from a side view and stand with proper posture, or in this picture, you can see this, the verbiage I use is ears over shoulders over hips. So ear, shoulder, hips, all on a straight vertical line. So that's why it's important to stand up nice and tall, pull in your stomach, tighten your buttocks, to maintain that natural S curve. And the ear, shoulder, and the hip are the points to help cue you for that. And the goal is to keep the back in its neutral, straight line position throughout the night, throughout the day, doing any kind of activity, whether standing, sitting, sleeping, reaching, pushing, pulling. It is so important to be aware and be cognizant about that neutral position. So I want you to think about an activity that you struggle with due to your back pain. And what specifically in the activity do you struggle with? So we're going to go over some examples now. One of which is dressing, which is a good example because it's a daily activity. Many people can't bend down to retrieve an item off the floor or on the lower shelf because of their back pain, nor should they be bending down this way. That's not advised. So how do we go about that? How do we go around that? So some strategies. In the picture shown is called a reacher, and I have some of these items here. I'm not pushing this agenda on anybody. These are available on Amazon for people that want adaptive strategies to go about that. This is actually found in what's called a hip kit, which is used for people like post surgery from hip construction or hip replacement. And what it does is it's just, you can grab an article of clothing if it's on the bottom shelf. If you don't want to use the device, you can also consider, as a more preventative strategy, storing items in your furniture that are more at torso level, so you're not bending over. So, yes. The same ergonomics are in place for bending down to put on your clothes. And to avoid bending at the waist, if you're unable to cross one leg over another to put on your pants, another idea is to use what's called a dressing stick. Also is given to you in the hip kit. Let me show you an example of what that looks like. You need to, okay.
You need sound? Here, let me. Yeah. Hold on, I'm gonna.
Just a little bit more of the dressing. The dressing is take.
We have. Hold on a second. I think we have, somebody, if you're unmuted, please mute yourself. That is.
Another idea is I could just demonstrate at the end. I have the tools here, I can demonstrate for you. Okay, you
Something in the middle of the screen.
like I said, if the video doesn't work, then demonstration.
Slacks. To use the dressing stick to help put on and remove your slacks, use the end of the stick to help thread each leg into the slacks. Next, use the hook to draw the slacks up until you are able to reach them with your own hands. Then stand up and pull up the rest of the way. To remove your slacks, push them down from around your waist and sit down. Once in a seated position, use the stick to push your slacks off of your legs.
I don't know why this, oh yeah, I'm back, but the video skipped over showing you how to take socks off with a stick, but I can show that.
Socks.
There we go. Let me see if I can get some. Something here would be bad.
Maybe try that.
Let's talk about
There's something else on there. I don't know why. All right, let me see if I can get technical help.
So there's another tool called the socket that's also available in the hip kit. And that also is to avoid bending at the waist if you want to put on your socks. And I can demonstrate that.
That works also on the shoe, works like
Yeah, for the shoes, no, we have another device.
that.
Testing. Testing. Maybe if we stop sharing and then share.
You're using mic?
I think often it happens if someone has on two devices, like if they're listening to you through their phone and their computer.
Right, but I have that off. I've muted everybody. Okay, let's see if, okay, we're gonna stop sharing. Is that any better?
Yes, it's better now.
Okay, so maybe it was, but now let's try sharing screen and see if that changes. Okay, how's that sound? Okay, I think we're good.
Okay.
All right, so you just have to speak a little louder in case, just so people can hear.
Yeah, and at the end, just to save time, I'll demonstrate how to use the tools. So we'll skip
No,
it.
it's still on hold.
Oh. It only started once I.
Your therapy team.
Okay. Okay, a hip kit also includes a long-handled shoehorn, and it allows you to put on your shoes without bending down. You can do it in standing or sitting. And I'll demonstrate how to do that. I have the device right here, and I'll demonstrate that, or you can come find me and I'll talk to you more about that. So if you can't bend down to tie your shoelaces, elastic laces can be used to keep your shoes secure while making it easy to slip on and off. And it allows you to adjust the tension and fit as necessary. And this is a better choice than slip-on shoes like Crocs, which provide very little support for the feet when walking.
So one more thing. All right, now try it.
Testing. And that's go. Okay, other daily tasks where back pain might be present is during bathroom activities. For instance, when showering, often when washing our back, we're twisting at the torso to get. Such as when we're on the toilet. So consider placing toilet paper directly in front or next to the toilet if you can, so you aren't straining your back, reaching behind when you're wiping. Same goes for flushing. Instead of sitting, twisting to reach the flusher when you're in the toilet, when you're twisting, do your business, wipe, stand up, turn your whole body around, and then push the flusher. That's just a little trick. Okay. Getting up from the toilet might be a struggle for some, especially if they're over bending at the waist. So to avoid putting yourself in this position, consider getting a raised toilet seat. I know they recommend these if you are status post hip surgery. Especially, and the ones that come with handlebars are great too. And the raised seat will keep your back in a straighter alignment with standing up. Many patients complain of back pain when brushing their teeth or washing their face at the sink if the sink is really low down. And if you have time, effort, money, and the legal rights to completely renovate your plumbing system, you could adjust that sink height. But obviously that's a very costly strategy. So a more realistic option might be either sitting the sink to wash your face And if that isn't a realistic solution either, and you have to stand, then bend from the hips as if they're a hinge, while keeping your upper, mid, and lower back in a straight line. To like as in the picture demonstrated there. To avoid overbending and overreaching, keep everyday items like your toothbrush and your toothpaste within arm's reach, aka the power zone. The next slide, I'm going to explain what the power zone is.
Let me just try one thing.
Sure.
I'm gonna leave the Zoom real fast and try coming back in. All right. And see if that helps. I apologize for the. Oh, come on. My apologies for this. I'm just trying to get rid of the echo. Come on. All right,
Testing.
can everybody hear? Can everybody online hear?
Yes, I can hear.
Yes, I can hear you,
Yeah.
Barbara.
We're good. Okay, so we'll go back to sharing.
Appreciate the patience,
Put
everybody.
you guys back on. You are good to go.
Okay. So there are a lot of chores that we do around the house that involve bending and lifting, like cooking, laundry, cleaning. And as mentioned before, consider what heavy items you tend to use every day, such as a favorite pan or a food item, and place it on a shelf that is at the height between waist, right, here's the waist, and the shoulder, no higher, no lower. This space is called the powerlifting zone, and it's the most ideal place to lift from if you can. Anything outside the power zone can cause an unsafe lift, resulting in injury. If you have to reach down for something, I'll show you the right way to do that. So, want to get as close to the item as you can. Want to bend, keep the back straight, of course. Bend at the knees. Take the item, hug it to your torso. And when you stand up, you're going to squeeze your glutes, squeeze your legs, and exhale. So in other words, this is the wrong way to do it. And this is the right way to do it. As mentioned before, try to avoid twisting at the torso when washing dishes or taking laundry out of the dryer. So instead, if you have to take laundry out of the dryer, pivot with your feet, pivot your whole body instead of rotating. All of these ergonomic tips, by the way, I've included in the handouts. Okay, if you shop at the store, use various strategies to protect your back. For instance, using a cart to move heavy items rather than carrying them. Pace yourself, take rest breaks, never be afraid to ask for help if you need to reach for something on a high shelf. When unloading items from your car or your cart, make several trips of light bags instead of multiple heavy bags. When you come home, perhaps set the groceries on the counter instead of on the floor. Avoid lifting. Okay, sleeping. Avoid sleeping on your stomach or on a soft mattress and box spring. Your mattress must be changed every few years. Dr. Gleb, what's the number? 5. Every 5 years. Otherwise, it gets too saggy. Why? Because sleeping on a firm mattress promotes proper spine alignment. And use pillows to align your body too. If you sleep on your side, the picture above, put a pillow between your legs. If you sleep on your back, place the pillow under your knees. And remember your spine. Remember your spine is an S curve. And you're using those pillows to preserve those natural curves in the right place, which will eliminate back stress. Remaining in any static position for too long, such as sitting at an office or in the car, or here, I apologize, or making you sit for a long time, is bad for the back. It decreases circulation and puts spinal disc into compression. It's crucial to take movement breaks and stretch every 30 minutes to keep everything loose. And you want to sit with proper posture, because slouching will put more pressure on the back. To sit with proper posture, use a chair that adjusts to your height, so it supports the lumbar curvature of the lower back. If you don't have a special chair like that, you can even place like a rolled up towel behind the lower back for that support. Make sure your feet are either flat on the floor or on a footrest, and keep your head and neck balanced in line with your torso. And if you're working at a computer, keep the screen at eye level. And actually in this picture, she's not supporting her arms on armrests, but that is a good idea. Okay, walking. If you experience back pain when you walk, you might want to check your posture. Some tips to maintain a straight back: avoid looking down unless there's a safety concern, you're worried about balance. Pull in your stomach, keep those abdominal muscles engaged. Make sure your hips stay level when you walk, because uneven swaying, as Dr. Gleb mentioned, can put too much weight on one side of the body. Also check to make sure that your personal belongings are not always on one side of your body, because that will contribute to uneven weight distribution. This might mean wearing a backpack instead of a purse on one shoulder, or alternating which pocket you put your phone or wallet in on your jean pocket. Like if you put your wallet in the left side every single day, that weight, eventually over time, you're going to be starting to walk like that. And apply these tips when if you use a walker. You want to walk close to the walker to avoid a forward slouch. So you want to stand up nice and tall, get as close to the walker as you can. Avoid taking flat steps or striking the ground toe first. Flat feet or low arches can cause misalignment and strain the lower back. Ask your doctor or a PT if you think you need orthotics or shoe inserts to address this issue. Lastly, if you lack hip mobility and strength, as Dr. Gleb mentioned, your lower back will likely overcompensate, causing spinal nerve compression. And as PTs and OTs, we designed a treatment plan particularly for you, with a variety of exercises and stretches that can help improve the hip flexibility and weakness. One of the ways to improve posture and back strength starts with education on the muscles in the core. And when most people think of the core, they think of the six-pack. They think of those abdominal muscles of the outer core. The outer core also includes the hip and the glutes, but your core also has deeper muscles that wrap around your front and others located along the spine and between the spinal bones. The inner core is very important also because it has your diaphragm, which is a muscle that sits below your lungs and helps with breathing, and the pelvic floor, which is between your tailbone and the pubic bone. And in PT, we really want to strengthen the superficial as well as the deep core muscles. So we're taking pressure off the back and stabilizing the spine. Okay, just a disclaimer, these are just a few things we do under careful guidance in the clinic. If you want to learn more about these, come see us. But this is just a sample of some of the things we do to strengthen our core muscles. One simple exercise we use is diaphragmatic breathing, or we use a ball press in the clinic. We cue the patient to take a deep breath in, feeling his stomach expand against his hand, then breathe out through pursed lips while pulling the stomach in to tighten the abs and the pelvic floor muscles. We also do an exercise where the patient tilts his pelvis backwards to the floor to simulate lower abdominal contractions. We work on back strength. One position that does this is the cobra pose. It engages your hamstrings, your glutes, your spinal extensors, and your upper back muscles. Another great one is where the patient lifts his hips up into a bridge position, keeping his back straight, and it helps again with the back muscles, the glutes, hamstrings, and the abs, relieving tension in the back. We work on, in PT, we work on improving flexibility in the hip joints and the hip muscle strengthening to alleviate back pain. On the left is an example of a hip extensor or hamstring stretch. On the right is an example of hip flexor or quad stretch. And when we add weights and resistance bands, we can strengthen the hip muscles this way too. Last slide. We also provide guided ways to stretch out the lower back, such as this yoga pose, this child's pose. And cow pose is where the patient rounds her upper back up to the ceiling, then arches it down to the floor. Because flexing and extending the spine, AKA spine mobility, improves circulation in the disc, lower back. So again, these are just just a brief snapshot of some of the exercises we do in the clinic. We do a whole lot more just to give you some sense of what muscles we target. Thank you so much for your patience with the technical difficulties, with listening to us. Encourage you to ask any more questions, and we hope to relieve you of your back pain.
Demonstrate if you fall and you're trying to get close to your bed, so that you can push yourself up onto the bed. It's a proper position for trying to do that.
Yeah, we review all of that in the clinic. That's a very important functional skill to learn in the PT clinic, and that's
Just I'm gonna jump in for online auditory. So the question was to demonstrate what to do if you fell on the floor. In general, that's going to be very specific, because what we're going to do in clinic, that's the risk, or at some point we do work with that. So we need to show you how you can do it, and that will depends on your strength, on your flexibility, on your level of overall function. Because I need one thing, we need different things, but we're able to develop a strategy for you how to get safely out. So at this point, it has to be specifically, we usually determine the whole session for it, because it takes time. We're not gonna rush you and come on, just get up. Because in a way, it's not just to get up, it's just to perform it safe. And the first thing, just keep calm, slowly seek for something that you can use solidly to support against, then you up. But in general, it's very individual. So therefore, we always take the time. Sometimes we're not doing it right away. But we do have patients that comes into us and tell us, hey, we want to make sure we're getting on the floor. We check the function and it's sorry, but you're not going to be able to do it safely. Let's get this first and then we can shoot. Because it's traumatic, but it's also needed a skill to. So it's a very important question. Let's do left to right. Go ahead.
Yeah, which slide? Okay, yeah.
And I can testify that that is an amazing back stretch. I had horrible back pain. And the first day I did techno, the next morning I got up without pain.
Motion is motion. Next question.
If we want to sit and read for a couple of hours, what is the best kind of chair to sit in our homes, and what is the best position for us to sit in if we want to read in bed propped up partially with pillows? Is that a bad thing, or is there a proper way to do that also?
So, but that's
So what's the best way to, because people can't hear you online, I have a question.
So the question is, what is the best way to set up yourself if you want to sit and read for a couple of hours? What's the best kind of chairs or so? So right now in auditory, there's the pretty firm chairs. That would be the chair you want to set up. You have to make sure that you have first comfortable. You might need additional padding on the bottom. Sofas is usually terrible. I actually just convinced one of my patients to throw away his new sofa because he actually got it. He felt it, he liked it, it's comfortable, but he stays there for an hour, cannot get up. And took some time, but he realized that he knew it, but he kept doing it. It's listen, you have a new thing, or you have a beloved chair and you don't want to get rid of it, but you know it's bad for you. Usually lazy boys are terrible, sofas with the big foaming and terrible. Memory foam mattresses is usually horrible also as well about the topic for the but what will be the best? Firmer, look for the arm support, so you can stand off of that or lean a little bit left or right. That has to be comfortable in the level. If you're sitting, you should not feel like it's arm support pushing your shoulder up or hiking. And regardless, multiple hours in a row is not good for anybody. So at least once in a while, or every half an hour, do stand up, sit down, like take a break, grab some cup of water.
And what's the best position for head and neck and
Neutral. It's going to be neutral, slightly chin up position. Be realistic. Nobody's going to be able to hold it all the time, but in general, as I said, that those breaks here and there will help you to readjust, will help your muscles to work. So how the muscle works is like, as we said, for joints, its motion is motion. For muscles, it needs to be contracted, so it needs to shorten and elongate. So if you do not move, that doesn't happen. Everything feels stiff and swollen a little bit. Therefore, here and there, just left and right, I'm sure you feel like I'm sitting here, like a little bit, starting from time to time to fidget. Body needs motion. That helps. So just the mobility. If you can get a chair, usually it's going to be if you have an office chair at home, you want to switch it to the gamer's chair. So like computer gamers, they have tall chairs with the lumbar and neck support. So you might look for something like that if you want to switch it, especially for those who work. There was one more question. Sir.
Yeah.
Yes.
Can you describe some aspects of sciatic?
What,
Sciatic.
in what way? Sorry, let me repeat that.
Back.
Describe some aspects of sciatic.
Yeah.
So what is sciatic? It's usually referred to the impingement on the root part of the sciatica nerve that leaves from around L2, 3, and I believe partially 4, and goes all the way down to your foot. Impingement at the root of it, it's like at the area where it comes out from the spine. That would be classical sciatic. Sometimes the sciatica nerve can be impinged in your glute by piriformis muscle. It's a muscle that through which frequently it passes. It's very interesting. Some people have it passing through the muscle, and if that muscle becomes stiff, you're gonna feel the shooting pain down the leg. Sometimes you're gonna limp. But some people anatomically, the nerve is actually going over, so they're less susceptible from impingement or having a piriformis syndrome because it mimics sciatica. But what we do with that, we simply work on the joint mobility. We're making sure we do lumbar mobilization if there's no fusion or any other aspect to free it up. There's also exercises for the nerve glides that actually provoke the nerve flossing, to floss through the tissues, and if there's adhesions or compressions to free it up. Would it answer your question, or there's any?
There are times when I get out of bed, not all the time. I will have this pain, shooting pain, not from the back of me, but down the back of my thighs. And I have to wait a while, and then when I start to walk, it'll go away.
Yeah, so that's another thing, like with the motion, it frees itself up. So in your position, even though it does use the distribution of sciatica nerve, like a back of the foot, but as you said, not directly from the back, you might not even feel it. Sometimes it might feel, oh, my calf is cracked. It's like that something tells me, like, for example, something interferes with the nerve. The question is where exactly? Is it mid-thigh? Is it performance? Is it that? So that has to be checked. One of the nerve conduction tests can be more specific to that, but it's like also it might be additional compression sites through the surface. So that is actually very resolvable. So if you don't have the prominent symptoms, it might be actually.
Thanks.
You will. Yes.
I've had sciatica last year at work at the Euro shops, and it's finally better. I don't feel pain in my ankle anymore. Should I continue to go? If I'm feeling well, should I continue to go to physical therapy?
Yes. Usually depends. You have to consult. If you're already attending physical therapy, speak to your physical therapist. Hey, did we reach the goals? Do I have that strength to make sure that I come back? So that comes to the great example for what I mentioned. Sometimes you need to receive that shot because you're in so much pain, you cannot do anything to help yourself. So that's why you do shot, and then you come back to PT to make sure you strengthen, and that mechanics that caused that problem in the first place is eliminated. Anybody else? Anybody from online? It is-
I think that's good.
So,
Yeah.
There's one more.
Just one?
One person or?
If you-
We have some gifts for people that have contributed to discussion or.
Oh, great, okay.
That's a shirt. Or I guess come at the end. Oh, no
Yes,
question.
please.
I got it, neuromed. It's level energy, it's on the back. And it's
Yeah, it's a tense unit.
um,
You can use it for the pain modulation. It seemed to be working great, but that's only a modulation. Basically, what the principle is,
Men's large.
you have pain, that signal that's sent to the brain, pain, 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 pain. And you know how the tense unit is starting to wait for, create another stimulant to override. So your brain does not perceive the initial signal. So you're basically looking for the signal from the neurostimulator is to scream louder than your pain signal. And that overrides the pain. So even though you're not gonna feel the pain, it's simply just covering. It helps to manage it, for you to go over it, but it's not treatment. It's like, we do use tense units within the treatment just to help to modulate the pain, but it's not the panacea to fix it. You're welcome.
All right, so thank you. Yeah,
An
hour went fast.
I don't think I'm here to demonstrate things.
You don't know what
Right.
it is, Okay, everybody, stay in the loop for the demonstration, please. Lauren will show you, I'm gonna run away, information, please stay.
Stay on. This, if you want to, if anybody wants to stay online, I'm gonna stop the, here, if you want to move forward, so
Yes.
people can see you. I think that's good.
Yeah.
And
Some of these devices are really ingenious.
okay. and
So
I'm
let's
just
say I
gonna-
can't bend down to put my sack on. Slide the sack on this way. Okay. Then I lower it to the ground with these lovely handles. And and then I would use the dressing stick. Down. Take it on. Look at that.
Oh, magic.
Yes, right.
Make him look so.
Yeah. But just so you know, there's a lot of different ways to manage the pain and to go around to get through your day and to continue being independent. So that's what, at the end of the day, that's what we want. We want to be as independent as possible, not rely on others and just get back to our meeting. Oh, yes, Ms. Burke. Thank you for saying that, Winslow. Yes. Actually, this is also good if like you have a shoulder injury and you have trouble putting on your shirt. I mean, I don't have a button down shirt to demonstrate, but then this hook is also for a zipper at the back. Or help.
How does that work with the shoulder?
With the shoulder?
Yeah.
So if I don't have a, but
You put your sleeve in
so
there?
you put, okay,
I
so
have a sweatshirt, you want?
yeah, great. So let's say this is the injured hand, right, the injured arm. You would put your hand through the right hand through the sleeve, but you can't reach around. So you would use this to pull, and then you can slip it in.
There you go.
Are these shirts for sale?
All right, take one, yeah, there should be a men's large in your size. So if I can't reach around this way. Thank you. I knew I should have practiced last night.
That's hard with that.
It is hard to practice, but okay, so redo.
So you put the hook down.
Yes, yeah. Where's the hook?
Here is the
Really?
step sleeve, you put it in the back.
Yeah, got it. Okay, there we go. No, you would use this, but you can't reach behind.
What does it say? I'm trying to figure that out.
Oh, you have to look at it.
Pull it towards you.
This is ladies. If you
Then-
want ladies large.
Yeah, I want to play this.
And then the shoehorn works with wearing weird shoes today, but
Open it up.
Oh, that's.
you can do it this way or standing up. They come in different lengths. So there's a long one, so you wouldn't have to bend down, but if you're sitting, I think this is the short handled one.
Oh.
Now, of course, okay, what my next question is, how am I gonna tie my shoes if I can't bend down? And if I can't do this, what do I do? That's where I mentioned the elastic. Right? Yeah.
I don't think you got baby though.
You saw this in the office?
We, oh no, we don't sell this in the office. We, you can get it on Amazon. It's, the one I got, it's like maybe $15 for all of these things. Yeah. Yeah, take your sweatshirt. Yeah, right. I like it. Hip, 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 hip. Because you know, when you have hip, when people have hip surgery, they're not allowed to bend for forward. And that's what they give them. You know, they still give it to them in the hospital, but they reckon, they say this is where you go, you get it.
Thank you.
Okay, everybody online, thank you for coming, and we'll be back.
Thank you.